Welcome to Health Living UK, your go-to place for pain relief tips, healthy food ideas, and overall well-being. Doctors warn, not all vegetables are as healthy as you think. Some could be harming your body. If you're over 50, avoiding these 5 vegetables could be the key to better digestion, less joint pain, and improved overall health. Watch till the end to find out which veggies might be doing more harm than good. Doctors always emphasize a balanced diet and the consumption of vegetables, especially for the elderly, as they are an essential part of a healthy lifestyle. But did you know that some vegetables can actually be harmful to older adults? Yes, not all vegetables are equally beneficial, and some can even lead to serious health issues. Today, we will share the guidelines provided by doctors that are crucial for the health of senior citizens. It is important to understand that as we age, our bodies undergo changes, and certain foods can cause digestive issues, joint pain, and even interfere with medications. Doctors state that while vegetables are generally healthy, caution should be exercised with certain ones. So, let's find out which 5 vegetables seniors should avoid, and the scientific reasons behind it. The first vegetable is eggplant. Eggplant is included in many delicious dishes, but doctors warn that it belongs to the nightshade family and contains a compound called solanine. This substance can cause inflammation and joint pain, particularly for individuals suffering from arthritis or other joint conditions. If you experience joint pain, reducing your eggplant intake could be beneficial. According to doctors, many patients have reported a decrease in joint pain after eliminating eggplant from their diet. Additionally, eggplant can sometimes cause allergic reactions in sensitive individuals, leading to itching, skin rashes, or digestive discomfort. To avoid these issues, seniors should either limit their eggplant consumption or consult a nutritionist for safer alternatives. The second vegetable is cabbage. While cabbage is rich in vitamins and antioxidants, it is also high in fiber, which can lead to bloating, gas, and other digestive issues in elderly individuals. Doctors specifically advise seniors who suffer from intestinal or stomach disorders to limit their cabbage intake. Additionally, cabbage contains goitrogens, which can be harmful to those with thyroid problems. If you have thyroid issues, doctors recommend reducing cabbage consumption, especially avoiding it in raw form. Fermented cabbage, such as sauerkraut, may be a better alternative as it contains probiotics that support gut health, but even that should be consumed in moderation. Moreover, studies have shown that excessive consumption of raw cabbage can interfere with iodine absorption, which is crucial for thyroid function. The third vegetable is tomatoes. Tomatoes are widely used in cooking and contain vitamin C, potassium, and lycopene. However, they are also part of the nightshade family, meaning they contain solanine, which can worsen joint pain. Furthermore, tomatoes have high acidity, which can increase acid reflux or aggravate stomach ulcers in elderly individuals. Doctors advise those who already suffer from conditions like acid reflux or heartburn to be particularly cautious. If you experience these symptoms, reducing tomato intake and finding healthier alternatives may be beneficial. Additionally, individuals with kidney disease should be mindful of their tomato intake, as high potassium levels in tomatoes can put stress on kidney function. Cooking tomatoes can sometimes reduce their acidic effects, making them slightly easier to digest for those with sensitive stomachs. The fourth vegetable is spinach. Spinach is considered highly nutritious, as it contains iron, calcium, and folic acid. However, doctors point out that spinach is also high in oxalates, which can be harmful to individuals with kidney stones. Oxalates interfere with calcium absorption in the body, increasing the risk of bone weakness. If you have a history of kidney stones or want to prevent calcium deficiency, doctors suggest limiting spinach consumption and opting for other green vegetables like lettuce and Swiss chard instead. Another concern with spinach is that, Despite its high iron content, it contains non-hemi-iron, which is less easily absorbed by the body compared to hemi-iron found in animal sources. Consuming spinach with vitamin C-rich foods like bell peppers or citrus fruits can help enhance iron absorption. The fifth vegetable is bell peppers. These colorful vegetables are packed with antioxidants and vitamin C, but they also belong to the nightshade family and contain solanine, which can be problematic for people with joint conditions. Doctors have observed that some individuals experience bloating, indigestion, and other digestive issues after consuming bell peppers because their skin can be difficult to digest. If you face digestive problems, it is advisable to limit bell peppers in your diet. Additionally, bell peppers contain a compound called capsaicin, which, while beneficial for metabolism, can irritate the stomach lining in sensitive individuals, especially those with acid reflux or gastritis. According to doctors, maintaining a balanced diet is key to a healthy life. If excessive consumption of certain vegetables negatively affects your health, it is better to find alternatives. If eggplants and bell peppers cause problems, consider replacing them with zucchini and carrots. If tomato acidity troubles you, try incorporating sweet potatoes or beets into your diet. Similarly, if spinach's high oxalate levels are an issue, opt for lettuce or cabbage as better alternatives. Doctors always recommend choosing foods based on individual health needs. Regular medical checkups and personalized dietary advice can play a significant role in preventing health complications. Instead of completely eliminating these vegetables, moderating their consumption and opting for well-cooked versions can sometimes help reduce negative effects. Moreover, drinking enough water and maintaining a fiber-rich diet with a variety of vegetables can help improve digestion and overall health. If you experience any health concerns, consult your physician immediately and make dietary choices that best suit you. Proper meal planning and mindful eating can go a long way in ensuring a healthier lifestyle in old age. We hope this video has been helpful for you. If you found this information useful, please like and share our video, and subscribe to our channel for more valuable health-related content. Let us know in the comments about your experiences with vegetables, and if you have noticed any changes in your diet. Thanks for watching Health Living UK. Don't forget to like, subscribe, and hit the bell for more health and wellness tips.